are watching me live on the Facebook page of News9. The reason I'm here today is to talk about the fact that for the very first time, coronavirus recoveries have surpassed the active cases. Yes, you heard me right. Even though the numbers continue to rise exponentially with each passing day, the silver lining is the number of discharged patients. So COVID-19 recoveries have overtaken the number of active cases. 1,35,206 patients have recovered so far from the deadly pandemic, while 1,35,205 remain active. Is that it, or is there more than meets the eye? We will discuss this a little later. Let me just quickly give all our viewers India's COVID-19 tally. So as I mentioned, active cases right now stand at 1,33,632. The recovered cases stand at 1,35,205. While the fresh cases reported in just a matter of 24 hours stand at 9,985. For the past few days, India has been registering over 9,000 cases every day. So number of deaths, of course, also stand at 7,745. With this, the total confirmed cases across the country stand at 2,76,583, which means that India is steadily, in fact, moving towards crossing the 3 lakh mark. Do remember that India's recovery rate right now stands at 48.99%. If you have to talk about the worst hit COVID-19 states now, Maharashtra, of course, goes without saying, continues to remain the epicenter with over 90,000 cases. Tamil Nadu has registered over 34,000 cases. Delhi, meanwhile, has also registered over 31,000 cases. You have Gujarat there as well. You have over 21,000 cases. Uttar Pradesh as well, over 11,000 cases, and Rajasthan as well, over 11,000 cases. Do remember that the numbers are subject to change. So India ranks 5th in the world in terms of COVID-19 cases after it surpassed Spain. If you have to talk about now, of course, what are the five worst affected countries across the globe? You have US with over 19 lakh cases. Then you have Brazil with over 6 lakh cases. You have Russia with over 4 lakh cases. You have UK with over 2 lakh cases, and you have India with over 2 lakh cases. Of course, 2,50,000 cases. So India is 12th country in the world to cross the 7,500 deaths mark. To speak more on this, I have with me pulmonologist Dr. Satish, who joins me live from Vikram Hospital. Very good evening to you, sir. I hope you're doing well. And now to speak about India's COVID-19 trajectory, of course, it continues to move upwards and the cases are expected to surge till the month of June to July. But the recovery rate of the country stands at 49%. How do you read these figures?
So thank you, Neha. Thank you for inviting me, and I'm very happy. The news that you gave, and with which we all have been seeing. So at least sometime for the audience and for the viewers, we have to give them good news. Every time we give them the bad news that so many people are dying, so many people have no beds, and so many people are affected, and many of patients that I see in my outpatients have severe anxiety. So with your with your program, which you have given a good news to all those who are seeing this program, that many patients are recovering, which is very true of this pandemic. The coronavirus, the novel coronavirus, which causes COVID-19, causes a very mild, like, a flu, regular flu that we all see in 85% of patients, and the recovery is 100%. In 10% of patients, they can cause mild symptoms of cough, breathlessness, who may require some supportive care. They may not even require any specific treatment. Another 5% of patients who have comorbidity, like severe diabetes, high blood pressure, ischemic heart disease, underlying cardiac disease, underlying renal disease, cancer, and so on, whose immunity is low, they have immunodeficiency, they can succumb to the disease. Even there, if you see, Neha, the fatality rate of those who are infected and those who have comorbidities is also, not very high. But comorbidity continues to be, and the age continues to be a risk factor. More than 65, more than 75, more than 85, we categorize them, like that. As the age advances, as the age goes up, the mortality also goes up. As you mentioned about all the statistics, the fatality rate in India is less than 5. In fact, 2.8 to 3 something it was about few days back, and which is very good. We have done very well, remarkably well. Various factors can be considered, why we are doing well and why others are not doing well, Neha, which is a good news. At last, we are giving some good news to our viewers and audiences who are
That's
watching
right.
this
Dr.
program.
Satish, I'm sorry
Yeah,
to interrupt, but on
yes,
the other side, the numbers are touching record levels every day. So how
yes.
believable is the government data, when it says that numbers are improving?
Of numbers are improving. You mean the recovery?
Yes, sir.
Yeah. So, it is expected to go up and higher with every day. It is not going to come down. Nobody has told anyone that it is going to come down in June or after the lockdown is taken off. It is going to go up and then, starts coming down. Look at Spain, look at Italy, look at UK. Of course, the US continues to have problems, but it's showing some kind of a flattening there. But most other countries have done well, and similarly after peaking. So similarly, we will also have that. So we will go on having more and more. Fortunately, India consists of a lot of young people or middle-aged people, less than 65 people, not older like in Italy especially. So that is why the mortality was high. We must believe the statistics. We can't question every time. Yes, the testing has to happen, which is increasing. As you saw from
Right.
March to
I was
now,
coming to
it's
that,
gone
doctor.
up.
There is a criticism that India
But
isn't testing enough. How do you respond to
yeah.
that?
No, these criticisms will always be there. In a novel coronavirus pandemic, we are always learning. We are always learning, changing guidelines by the day. So what we are doing, Neha, is that we are only testing, those who are symptomatic, which is correct. We don't have to waste our, resources and preserve our resources for protecting doctors, nurses, and other frontline workers. We need this PPE kit and so on. It is not just testing alone. So if you are testing everyone, who are asymptomatic also, is useless. So test those who are symptomatic, which is correct. And we are changing these guidelines as you saw.
All right. So, doctor, another important question that's been widely
Yes,
discussed is about community transmission. Has India
that's
stepped
right.
into community transmission stage yet? What's the truth behind community transmission? Because there are statements that
Yeah.
vary.
Yeah. So I have friends in ICMR who are in touch with me, and I'm in touch with them. Right now we can say that there is no community transmission. If there is a community transmission, absolutely the ICMR will come and say openly that there is a community transmission. We have seen cluster transmission. We have seen some local transmission. Like example is Dharavi,
Yes.
where we saw,
Asia's biggest
some
slum.
transmission. And also there is some suspicion about, in Delhi, so about the community transmission. But
True.
so far, in India, there
In
is no
Mumbai as
community
well, sir.
transmission. Yes, absolutely. Maharashtra also is going higher than, in fact, Delhi. Yes, it can happen. If it happens, we have to come out and tell, and which ICMR will tell, so that we warn them about, various opening and unlocking things which are happening. So there is no hiding here. One should not hide also, and there is no point hiding here. We have to tell what is happening. It is not going to be politicized, and it is not the fault of the government. The virus is like that. The pandemic is like that. But the way we act, the way we react to this pandemic is important. What steps we take is important. How we protect our patients is important. How we protect our vulnerable, the old people is important, Neha.
All right. So another, question that I
Yeah,
would like to take your reaction on is that India's
sure.
COVID-19 peak. When are we expected to see India's COVID-19 peak? Again, there are different statements, because one side you have the AIMS director who says that the COVID-19 peak will be in the month of June to July. Then there are other statements given out which state that the COVID-19 peak will continue till September. So what's the truth behind it?
Yeah. So these are always, guesstimates one can do. And the AIMS director, my good friend, Dr. Randeep Guleria is an amazing man, working day and night. And he also a good scientist, also a good pulmonologist like me. So what he said was, yes, correct. In June it will peak because that is the natural history of a pandemic. It goes up and takes some time. Unlike what happened in Italy, there it didn't take time. Here we had lockdown, a good lockdown for at least for about a month or so, and then all those prevented a peak which was supposed to happen in March or April itself, or May itself. So it is, yes, June is going to be a peak. These are all guesstimates. Some
All
are
right.
saying because of the rains and so on, maybe August and September. So if we have August and September, we have time to prepare. We have time to prepare, and our preparedness and our work will continue. You know, continue without any problem. Throughout this pandemic, we cannot relax saying that this the peak is over and it's coming
Absolutely.
down. Recovery is there. And Neha, very important message for everyone, who are watching this, that don't relax, thinking that, recovery rate India is high, 85% recover, only less than 5% die. But India is a huge population, even 1%, 2% can make, big difference. So continue to practice hygiene, continue to wear mask outside, and continue to do social distancing, not to forget this, not to relax on this.
Absolutely.
Yes,
Absolutely,
yeah.
absolutely, Dr. Satish. Thank you
Thank
very
you.
much.
Yes,
We
yeah.
appreciate you've taken out time from your busy schedule. Thank you very, very much for joining us. You heard Dr. Satish there. It's not the time to relax, it's the time to gear up and make sure that you and your family members are safe from the invisible enemy. Thank you very much for watching. If you find this helpful, do not forget to subscribe News 9 YouTube. Like us on News 9 Instagram, Facebook, as well as Twitter. Thank you very much for watching. Stay safe.